Welcome back. Our next guest is a retired nurse. She says she used to have knee pain that forced her to take stairs one at a time, clinging to the rail, and she relied on anti-inflammatories like ibuprofen and Tylenol. Her knees also limited her walks with the dogs she loves. Then she watched The Morning Blend and a segment we did about a treatment to relieve pain without meds, surgery, or injections caught her eye. Sherri is the RN who says her life has been transformed by the pain-free program at New U Health and Wellness. And Stacey Roberts is the owner of the clinic. She's also a nurse herself, a physical therapist, and an author. Hi, ladies.
Hey, Molly.
Hi.
Great to see both of you. I mean, looking at this video, Sherri, I mean, it's incredible that you're walking your dog, you're doing the stairs, you're walking on uneven ground. What was most beneficial to you, would you say, about New U's pain-free formula?
Well, for me, it was not an invasive procedure. And I thought, well, why wouldn't I try this? There's other things out there that I hear that are like that. And so I made my appointment, and I wasn't excited about thinking about surgery in the long run. And I didn't even want to entertain that. So this is where I started, and it's really made a difference.
Yeah, I mean, we can see it from the video. Talk a little bit, if you would. You're a nurse. You've tried PT, you've tried medications and other interventions. We're going to talk about how SoftWave works in just a second, but were you skeptical of this because it didn't require surgery or any of those other things?
Not really, but at the same time, because it's a newer procedure. And I listened to Stacey talk about how she helped other people, at least more than once for sure. And like the medications and stuff like that, I used some topical stuff too, like arnica or their works, but it didn't seem to help it. It's almost like what I figured out once I had the SoftWave procedure, it really made a difference, and I didn't think about taking ibuprofen or Tylenol.
What was your first treatment like? And I'm curious
Which
to
is
know
good
if you
not
noticed,
to have to take too many.
Yeah, what was your first treatment like, and did you notice improvement right away?
Definitely right away. I walked out of here and I was like, oh my gosh. Oh my God, it really made a difference. And Stacey gets into the detail of how it works. But it really did make a difference the first time. And we did 3 I think on both my knees, and each time it did its job, and it really helped. And now we're on, like, I come here like once a month, unless there's something else, I'll make another appointment. But even then, right away, there's a difference, and my knees continue to get better.
That's so great to hear, and seeing you in the video walking your dog, who I know you love, and we're hoping to get back to that, is wonderful. Stacey, if somebody has arthritis, because a lot of times that sort of happens along with maybe an old injury or something like that, doesn't that mean that someone's always going to have pain and that joint's always going to be a problem?
That's a great question. I get that all the time. Arthritis is the inflammation in the joint. So if we can knock down that inflammation, we're not necessarily going to reverse arthritis. Like, my knee's full of arthritis, but I have no pain in my knee at all. And that's what we're trying to accomplish with this. And people have bone on bone. They think that, things aren't going to help except for surgery. But usually, there's significant inflammation that can be decreased so that they feel better and can get back to being active. So this can even help with bone on bone arthritis as well.
I can see why when people look at it, they think it's maybe too good to be true. I certainly thought that. We've treated my ankle and my shoulders. I mean, it's and the fact that people have an improvement after just one treatment. So how does SoftWave work, and how does it help to reduce inflammation, like for Sherri, where they can get out and do the things they love again?
So it really nudges the body's the body into its own natural healing process. So it moves the patient from a pro-inflammatory state where it's really red, puffy, swollen, sore, painful, into an anti-inflammatory state. It's not actually doing that. It's just encouraging the body to do that. So it's decreased the number of treatments I've been able to do for patients over the last 30 years by at least half. And then we add some exercises to it to make them stronger and take a look at their biomechanics, make sure that they're moving well. And that takes away the trigger of the pain. And then the inflammation can go down and they feel better and can get back to what they love.
Are people shocked that they often don't need surgery and that they can heal with this device after a few treatments?
It's usually that wow factor, especially in that first treatment, where they walk out and go, wow, literally, wow, like I didn't really realize I could be pain-free in the first treatment. And then with each subsequent treatment, that lasts longer and longer. So yeah, people are usually shocked. Thanks for the pun, by the way.
Quietly shocked.
I love it. In your book, The Pain-Free Formula, you talk about SoftWave so much and all the different things it can treat. So just give us kind of a list. Shoulders, right? Knees, obviously. What about hips and ankles and...
Yep. Any muscular joint, really, from top to bottom, is fair game. And I've talked on the show before about what it can do for pelvic health as well, too. We've talked about incontinence and sexual health as well. So it really is anything that needs increased blood flow to improve its ability to do what it's supposed to do, muscles, joints, things like that. Scars, it can help with reducing scarring and improving, results after surgery. It really has a big gamut. So, when people call us, we can explain and tell them whether there's something that they're dealing with, that whether it will work for them or not.
Yeah, whether or not they're a great candidate. Well, Sherri, congratulations to you on your healing. Stacey, great work. Yay, I know, I get it. It's so wonderful to see you out and about like that. Thank you both so much for joining us today.
Yep. Thanks, Molly.
Thank you.
Appreciate it. And right now, New You Health and Wellness is offering a $59 trial offer. You got to try it to make sure that their program and the SoftWave technology is right for you. Are you a candidate? Give them a call. You can talk it over. It's 414-299-8121 to see if you qualify. You can also purchase Stacey's book. It's called The Pain-Free Formula on Amazon or through the clinic. And tune into the Pain-Free Formula podcast on iTunes, Spotify, or wherever you get your podcasts. I was recently on the podcast, so maybe that episode will air soon.